Hope you're doing well. I'm Dr. Milind. So through this interview series, we are hearing a lot of inspirational stories. A lot of students are facing a lot of challenges during their preparation. But if we talk about challenges, today I'm going to introduce to you to one such PG topper who had the most challenging PG journey that I have seen. We talk about a lot of hardship that we have to face, about the personal life, about the family problems, about the things that we have. But there is a student who not only faced the family and the personal issues, but also the environment that she studies in was not very easy to study. So guys, let's welcome. Today we have Dr. Mansi, who have completed her MBBS from Srinagar. And today we are going to hear her story. She has scored an amazing rank of 5,000 in the last NEETPG 2022. So hi Mansi, I welcome you to this conversation. Please introduce yourself.
Thank you so much, sir. This is Dr. Mansi. And first of all, thanks to you that you gave me this opportunity so that I can share my hardships and all the things that I've gone through with you all. And I've done my UG from northernmost part of India, that is Kashmir, and that's Government Skims Medical College. But I basically belong from Kathua, which is a part of Jammu. So that's me.
Yes, so thanks for that kind introduction. So tell us about your MBBS days, because it's not easy to study, it's a kind of a difficult part. So how was your MBBS curriculum, and what are the difficulties that you faced during your MBBS days, and how did you prepare? How did you study during that time?
Sir, it was a total chaos, I would tell you. Before I entered into my MBBS college, there was you must have heard Kashmir flood and all, 2014. So before I entered there, it was a really messed up situation. My parents were really scared if I should join or not. But then I cracked that seat, and my parents motivated me I should go. And despite of all the situations that are difficult there, I should join there. So we went there. We started off in the first year. It was smooth. It was kind of smooth. But in between, we were thinking that is our batch lucky enough that there's nothing happening in Kashmir till now. Then there was a chaos that started. You must have heard about the killing of Burhan Wani.
Mm-hmm.
It was a incident that happened in 2015. I wrote it down here, 8 July 2016.
Mm-hmm.
So after that, it was our sent-up exams that were going to begin when this incident happened. We were in hostel. We used to stay there in a place called Rajbagh. So there was all the bombarding and shelling, and we used to hear these stuff, and we used to study. We used to try to memorize the diagrams of anatomy in that scenario. People were killing each other. Army was employed. They were protesting, and we used to listen to all that stuff at night. We all girls all together used to study in a room, and we were just trying to get through that phase. That okay, fine. I was very little. I was only 17 years old when I joined MBBS. So kind of scared. I was only single child. So my parents were also very scared that you should come back home, leave this all, to just join us back at home. But then we tried to get through that phase. And finally, it was the time that Army deployed us back to our homes, because the situation was not really great, especially for medicos who were living outside and non-Kashmiri people like us. So we came back home, and it was the first time where I felt, okay, my journey is not going to be that easy, that normal as other people. When I used to hear interviews on YouTube from toppers and people who used to live in metropolitan cities, that they start off their preparation from second year. And I thought, come on, I cannot even study normal textbook here. So yes, it was very difficult. Then we came back, we gave our exams in first year, and it was fine. It was good. I performed nicely because I studied at home. My parents supported me, all of them from a non-medical background. So in the second year, it was a honeymoon phase. Same for us, no chaos. It went fine. We were thinking that how it could be possible that we're lucky enough now. Nothing is happening. Wow, Kashmir is at silence. So that really didn't happen until the abrogation of Article 370 that everybody knows. It came in 2018, and it was mid of our second year. So suddenly basically what happened, we were there in our rooms, in hostel rooms, and suddenly our principal gave an order that you have to leave your hostel rooms and take out all your stuff that you want to take, and you'll be back soon, but that's what government has instructed us to do. So we were like, okay, this is something that happened in the first year also, so we have to, I guess, get back in some time now. So I packed my stuff. I didn't take many books. I took pharmacology. I still remember. I used to hate it, so I thought I would remember drugs at home. I would memorize it. I took the books and I came back home with pharmacology only. So abrogation came. I started studying. We had no idea. We were airlifted from Kashmir to Jammu, and I heard about Marrow. That is an online platform that you can study from. So I bought Marrow and I spent 30,000 on it. I still remember my parents were against it, that no, you should study books. Then I told them I don't have books. I left them there only. So where do I study from now? So I bought that, and when I bought it, I remember 3 days exactly after it, there was abolition of the internet here. So it got banned. We didn't know how long it is going to be. We were not being called back. So not a normal medical study or a medical institute as such. So I basically live at a place, it's Kathua. It's on the border of Punjab in Jammu. So what happens is there's a bridge that you cross and you get signals from Punjab for internet. So my mom, once we were going to our Nani's place, she lives in Pathankot in Punjab. So we got the signals and I was very happy. Come on, I'm using internet after 3 months. So I went there on the bridge. I saw that, okay, people come here, they use internet, and I can use this stuff for my studies. So my mom motivated me. What I used to do was every morning I used to go by scooty or car, and I used to download videos, because Marrow had this feature that you can only pre-download 10 videos at a time. So I used to download 10 videos and I used to come back home. I used to watch them, and then accordingly, whatever I could study from there, I tried to, because I couldn't use question bank. I didn't have notes. So videos were the only thing that I used to watch at that time, so that I could get an idea, okay, what normal medical studying looks like. So that's how the journey it started,
I mean,
and it
this is definitely
continued.
so much of challenges that you faced, just to get the internet. I mean, I cannot imagine my life without internet, even for a day. And having been, not able to
Yes,
use
sir.
internet even for studies for such a long time, and to juggle between, two places, two states, I will say,
Hmm.
to, get that internet
Yes,
and
sir.
get that video. So that requires a lot of dedication and, the kind of hardship that you went through, and it's just a matter of life and death, like when you are in your medical college. So studying and living under such circumstances and staying motivated in such scenario, I think it's very inspirational. So as you said, you had a very intermittent access to the like online sources, because
Internet.
nowadays online
Yes,
sources
sir.
are the mainstream. But you said that your textbooks
Hmm.
was your main base during your UG time, because internet
Yes, sir.
was never, like, it wasn't available for you, unfortunately.
Never.
So textbook
Never,
was
never.
your mainstream. So for those listeners, for all
Yes,
the
sir.
students who think, a lot of students have this debate and this opinion that where when should we join? Like, should we join any online platform in second year, first year, or
Hmm.
well, there is no timeline. So I just want to highlight again this part, that Dr. Mansi had only read her textbooks. These students did not have any access to online coaching because of the kind of scenarios they had in the state. So even the textbook, and within 4 months she cracked. Like after she completed her graduation, within 4 months, just on the base of her textbooks, she got within 5,000 in NEETPG 2022. So that is why never ever underestimate the textbooks. If you are going to do it with honesty and discipline, you'll definitely do it. So how was your study plan? Like, how did you do your how did you read your theory? How did you practice your MCQs? And what was your plan?
So, as you said, my basics were clear because I had only time at home with my books. So my basics were quite clear. You can say ratifying or whatever, but yes, I had gone through all the standard textbooks. So when I was doing externship basically in GMC Jammu, because my parents were against this, that you are not going to stay in Kashmir now, so you come back home. So for those who don't know, Kashmir and Jammu are separate places. So I came back to Jammu at my home. I joined there, but I was an extern, so there was kind of a little partial environment there because I was an extern. So it was very difficult to go on with my studies and with internship also. But I planned my preparation that I had access to internet now in Jammu. So I thought that I cannot go on with videos. I had my basic knowledge that was strong. So I would practice as much questions I can along with the clinics, because in everybody knows that in 2019 to 20 there was COVID, so I did not attend clinic classes. I was at home during my final year. I had no classes that I gave during the final year, so no clinical practice, nothing. I just went there and gave my exams. And when I started internship, I got an access to clinical patient and clinical environment. So I used to see the patients, and whatever the topic was related to that, like in surgery, if there's a case of gangrene or there's a Fournier's gangrene, I used to see it. I used to study it as much I could, and I used to practice questions. So during the internship days, didn't have enough time, but sticked on with the preparation of practicing questions. And I had this thing in mind with you can say my mentors guided me or my seniors guided me, that you have to practice questions and you have to think of keeping your preparation and revision planned, because it is not the matter of how much you have studied, how much you have gone through the textbooks. It is the matter of that last 1 month and the last 10 days, that how are you going to schedule your revision, because your memory is something that is going to decide the difference between a topper and a normal ranker.
True.
So that was something that I was very clear in my mind, that okay, I have to keep notice of everything, keep notice of topics that I'm going to revise in the last 10 days. So I used to make notes on my iPad, which people call it as 20th book, but that was not basically a 20th book for me. It was a kind of some topics which I kept for revision for the last times, and that's how I planned everything, that I'm going to appear in the exam like this.
What was your approach to the grand test? A lot of students now have this. We have subject-wise test, custom modules, and grand test. So how was your approach to that?
Sir, there was a senior of me from AIMS Jodhpur in pediatrics. So he guided me that from the day one that you start off your preparation, you have to give grand test no matter what. It is going to be scary, but not as scary as Kashmir. So you have to just appear in it like you are going to fight off. And I did appear from the day one, and it was a bad journey to start off with. I scored drastic bad marks in GTs initially, but it was kind of a thrilling environment for me, that okay, I have to take it as a challenge. If I'm not being able to do it now, from I'll start off with my lower 5 subjects, whatever the GT score was. The last 5 subjects that I used to get, I used to memorize it at first thing in the morning. I used to do was I used to pick those 5 subjects, revise questions, revise notes from that, and then I used to pair in GT again. So for all those people who think that they can skip the GT part and they can do it later on when exams would come closer, no. Giving actual exam, there 2 lakh people are sitting, so they are your enemies basically and competitors. So you have to fight off them.
Yes.
You have to get yourself prepared, just like you get yourself prepared for the university exams. You practice a lot, you study a lot, and then you appear for the exams. So GTs, I think, is a must thing, that it should be
Yes,
taken from day one.
I would definitely agree with your point. Just what I would like to tell the viewers who are watching this interview, what she said about analyzing GT. It's important that you should know. But as she said that she was able to highlight those 5 subjects or those subjects which were weak, and then she worked on them, and then eventually you will see the improvement. So just don't look at the rank and go back. Like, a lot of students, why, I say that GT is a double-edged sword. You should be able to use it in a proper way. Like, you use it, you write your GT, you see what are your weaknesses, you work on them, and then you write it again, and then you'll know that, okay, I'm doing better now. I'm better than what I was. And as we say, we are preparing for the new kind of competition. So if everybody is doing that, we happen to do that. Okay, agar, every student is going GT, so we have also the kind of that feeling that a student has, that I also have to give it. But you should analyze it properly. There is no harm in giving GTs, but if you don't analyze it, I think it's a waste, and you should definitely do that. So
Yes,
Dr.
sir.
Mansi has definitely planned that way.
Mm.
Did you doubt, a lot of students, because you had only 4 months, like you cracked exam in that small, amount of time. So did you doubt yourself, the kind of journey you had, all this, roller coaster ride during your undergraduation. So did you doubt, that negativity and all? How did you fight that?
Yes, sir. Of course, of course. There was a lot of negativity. My the biggest negativity that I was going through was when I attended internship and I went into surgery. I thought I have to study very much hard because I don't want to take surgery. So if anyhow I end up into a surgical branch, that would be a total disaster for me. So I used to cry a lot in the initial times when exam was scheduled in March. I was not prepared. My internship ended in January. So I used to think that how can I prepare in 2 months? I used to go to Mama, tell her, Mama, that if I get a surgery or anesthesia or a lower surgical branch, then what am I going to do? So she was the biggest inspiration for me. She used to tell me, Bache, whatever it is going to happen with you, either it's a non-clinical branch or a clinical branch, it is you who's going to make a difference. Even there are physicians who are very normal, who are not that famous, who are not doing great, and even there are pathologists who are doing great in their work.
Very
So
true.
it is you who's going to make a difference. It's not the branch. So she was the biggest support. She said, even if you drop, we are not going to take care of the society, what they're going to say. You're going to sit in this room. This was my room. I used to prepare her hair. So she used to tell me, just go on with that. And I think she was the biggest support for me, who had me fight with the anxiety and all the negativity. And it could be anything for the viewers who are watching. For you, it could be anything, a senior, a friend, or you yourself, or a book maybe. But it is you who is going to fight off the negativity. Nobody else can help you, I feel.
Very true, very true. And yes, Mansi, that's a really inspirational and a very unique story that you have. So the viewers who are, who are watching this video, I just want to tell you, there are two things that we can learn. First, that Mansi had, had to fight a lot of things. During her undergraduation, there were certain circumstances that she had to fight off, and still she did not give up. Second thing is, lot of students, they wonder, they always get surprised, someone, they crack exam in 4 months. So as Mansi, she cracked exam in 4 months, but it's not that 4 months, but you can see, you have now heard her journey. She has been reading her standard textbooks during her undergraduation, and she told that, her basics were very strong. And that is something that I have been telling students again and again. This is very important. You have example in front of you who have fought of very exceptional circumstances, and within 4 months was able to crack NEETPG 2022. So Mansi, very very congratulations, many congratulations, and we are very proud of you. The kind of things that you went through. So I'm sure this journey and this
Thank you,
story
sir.
is going to bring a lot of hopes, and a lot of it is going to inspire to a lot of students. So thank you so much
Thank you,
for
sir.
joining us and sparing the time. I wish you all the best for your future.
Thank you, sir. Thank you so much.